Our next three speakers will now share a range of initiatives designed to prevent suicide across different communities. To learn more about efforts to prevent suicide among college students and high school and younger students, we're now joined by Nora Maloy, Director of Programs for the Blue Cross Blue Shield of Michigan Foundation. Blue Cross Blue Shield of Michigan Foundation is leading an innovative program to improve mental health and prevent suicides on Michigan college campuses. In partnership with the JED Foundation, they created the Michigan model of campus mental health to build a culture of campus-wide awareness of mental health. More than a dozen Michigan colleges and universities have adopted this model, and at least one other state is looking to replicate it. Nora is leading the foundation's efforts, and we're so grateful she's here with us today to share this work. Nora?
Thank you, Catherine. As Catherine said, and with the Blue Cross Blue Shield of Michigan Foundation, we are the affiliate of Blue Cross Blue Shield of Michigan. We have an independent endowment of close to $60 million, which enables us to make grants of between $2 and $3 million annually throughout the state. Our mission is to improve the health and health care of the citizens of Michigan. Today, I'd like to talk with you about why the Blue Cross Foundation has invested in two programs to address the mental health of our youth to decrease the alarming suicide rate. The two initiatives that I'd like to talk with you today are aimed at campus mental health, one at the college level, the second at the high school and below level. Both are partnership grants, meaning we've solicited other partners to join in to expand the scope of the projects. Last year in Michigan, there were 1,364 suicides. It was the second leading cause of death among our youth, as Dr. McCann has pointed out. 20% of students have a mental health condition, but close to half of these students haven't received any behavioral health treatment. Nationally, among our college students today, over 2 million had serious thoughts of suicide at some point during the year, and 336,000 made an attempt at suicide. More specifically, our grantee, JED, has told us that 71% of colleges and universities had at least one suicide in the past academic year. 78% reported at least one attempt, and 70% reported at least one psychiatric hospitalization. About 5 years ago, the Blue Cross Foundation sought ways to address mental health and suicide among our youth. We met the JED Foundation from New York at a conference and really liked what they were doing around the country with college students. We brought in 4 other funders, the Flynn Foundation, the Michigan Health Endowment Fund, the Community Foundation of Southeast Michigan, and the Children's Hospital Foundation to develop a Michigan model of campus mental health. With a grant of $265,000, we brought the JED program to 12 schools, universities, colleges, and community colleges in Michigan. With JED, we designed our own campus program specific to Michigan. We asked JED to design a Michigan model, collaborating with other leaders in the field, including Healthy Minds, Active Minds, and the Steve Fund. JED's Michigan model is based on a comprehensive public health approach to promoting emotional well-being and reducing suicide and serious substance abuse. JED believes well-being and suicide prevention must be seen as a campus-wide responsibility, not solely the responsibility of the health and counseling centers. This includes the support of senior leadership to make emotional well-being and suicide prevention shared values for the entire campus community. Regarding suicide, when JED works with specific schools in training faculty, staff, and students, they warn faculty, staff, and students to look for students who talk about killing themselves, feelings of hopelessness, having no reason to live, being a burden to others, feeling trapped, and with unbearable pain. They're looking for students who exhibit certain behaviors, increased use of alcohol or drugs, looking for a way to end their lives, such as looking online on certain websites, withdrawing from activities, isolating from family and friends, sleeping too much or too little, visiting or calling people to say goodbye, giving away prized possessions, aggression, and fatigue. These are students who exhibit specific moods such as depression, anxiety, loss of interest, irritability, humiliation, agitation, anger, or perhaps sudden improvement. Together, the school and JED work together, collecting mental health and substance use history among incoming students, connecting students to services, having wellness and screening days conducted across campus, training on how to identify, reach out to, and if needed, refer students who may be struggling, and implementing behavioral intervention care teams electronically as well as feet on the ground. This information is standard for all students at all JED's campuses, but community college require additional support. Many community colleges do not have health or counseling centers, or if they do, they're seriously limited. JED works with schools to develop robust referral networks with their local community providers, community mental health centers, and hospitals. This includes working with schools and community providers to help identify sliding scales for students, what insurance are accepted, and to help with wait times for appointments. Since community college students often just come to campus only to attend class and then leave for jobs and family responsibilities, their primary and sometimes only contact is faculty. So JED focuses on training faculty on how to identify, reach out, and refer students who may be struggling. Also, since many students will not be on campus to attend programming outside of class, JED suggests the use of educational campaigns and public service messages online. Providing online cognitive behavioral therapy and other therapy online is another way for students to more easily access services when convenient for them. In brief, at the start of the 4-year JED program, they assess the resources and needs of both the school and the students. With the school, they build an interdisciplinary team. They then help the school to develop a strategic plan for mental health, which includes building a structure to identify students at risk, increase help-seeking behavior, provide mental health and substance abuse services. The assigned JED campus advisor and college interdisciplinary team continually assess progress and provide resources for continued progress. After implementation, there's a post-assessment and JED consultation. The school continues to then be a part of the JED campus learning community. Of the 12 schools we fund, some of the things they do specifically unique to them are at the Mott Community College. They have compiled a calendar of training and programs to map existing approaches, identify gaps, and build out new programs, in addition to working on specific training around alcohol and other drug use, as well as gatekeeper training. And at Northern Michigan University in Marquette, they're exploring options for teletherapy, tuition insurance, and health insurance that will cover behavioral health. Streamlining communication processes in response to student deaths is being done at Wayne State University. They work with how to deal with the aftermath of a student death. And finally, at 3 of our schools, Kalamazoo College, the University of Michigan Dearborn, and Western Michigan University, they're all a part of the Equity and Mental Health Framework cohort that JED has developed to specifically work to address mental health and well-being of students of color on their campuses. The second program I would like to talk to you about is Trills. Trills is a program that we expect to impact suicide. It's led by the funding collaborative is led by the Flynn Foundation in Detroit, and it's being implemented by the University of Michigan Department of Psychiatry. We plan to implement Trails in each and every school in the Detroit public school system over the next 3 years. There are 7 funders collaborating in this funding initiative. Trails is not technically a suicide prevention program, but a comprehensive behavioral health support to schools that recognizes that lack of access to mental health care among youth is a major contributor to adolescent suicide, especially those experiencing symptoms. Trails has taught us that suicide in young people is related to the fact that they lack some prefrontal cortex development, which helps with complex decision-making, impulse control, and emotion regulation. So when a teen has deeply depressive or anxious emotion but lacks access to effective care or treatment that could help them manage or cope with those emotions, rash decisions such as the decision to commit suicide become more likely. By linking teens with effective skills based in cognitive behavioral therapy and mindfulness, the core of Trails, these teens will be better equipped to manage their emotions, to feel some sense of control over their self-defeating cognitions and very difficult feelings, and will experience some hope that they will get better. The Trills program is built on a 3-tiered approach. Tier 1 is for the vast majority of kids. It provides programming and prevention and stigma reduction. It also provides training to engage all faculty, students, and parents. Tier 2 is for students in need who are impacted by behavioral health problems. And finally, Tier 3 are for students who have been identified for risk of suicide. This tier provides immediate resources and the coordination of care. I would be glad to provide more information on any of these programs to anyone who requests them, and thank you so much.